for NCLEX categories. Question 1. Set 1. Which electrolyte imbalance is associated with Trousseau sign? Hyperkalemia, hypocalcemia, hyponatremia, hypermagnesemia. Trousseau's and Klosteck's signs indicate hypocalcemia. Question 2. Set 2. Which is a characteristic of croup? Productive cough, barking, seal-like cough, wheezing on expiration, high fever. Croup is characterized by a distinctive barking cough caused by laryngeal edema. Question 3. Set 3. Which medication is used to treat a suspected opioid overdose? Naloxone, flumazenol, atropine, epinephrine. Naloxone, Narcan, is an opioid antagonist. Question 4. Set 4. A child is admitted with tetralogy of Fallot. Which position helps during a tet spell? Supine, knee chest position, prone, side lying. Knee chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 5. Set 5. What is the significance of the TNM staging system? To determine the cause of cancer, to classify the extent and spread of the tumor, to measure the effectiveness of chemotherapy, to identify genetic markers. TNM stands for tumor size, node involvement, and metastasis. Question 6. Set 6. A patient is experiencing an acute manic episode. What is the priority? Involving them in group therapy, providing a high-calorie, finger food diet, teaching coping skills, encouraging social interaction. Manic patients have high energy and may not sit for meals. Finger foods provide necessary nutrition while on the move. Question 7. Set 7. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 8. Set 8. Which condition is characterized by current jelly, stools, celiac disease, intussusception, Hirschsprung's disease, Crohn's disease? Intussusception causes stools mixed with blood and mucus, appearing like currant jelly. Question 9. Set 9. Which type of immunity is gained after receiving a vaccine? Natural active, artificial active, natural passive, artificial passive. Artificial active immunity results from vaccination. Question 10. Set 10. A nurse is caring for a patient with atrial fibrillation. What is the primary risk for this patient? Heart failure, thromboembolism and stroke, ventricular tachycardia, hypotension. Stasis of blood in the atria can lead to clot formation and subsequent stroke. Question 11. Set 11. A patient is post-bronchoscopy. What is the nurse's priority assessment? Pain level, gag reflex, urinary output, blood pressure. The gag reflex must return before the patient can safely eat or drink to prevent aspiration. Question 12. Set 12. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hematmesis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 13. Set 13. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 14. Set 14. What is the priority intervention for a patient experiencing chest pain? Administer morphine, obtain a 12-lead EKG, check blood pressure, call the family. A 12-lead EKG is the priority to determine the cause of chest pain, ischemia versus me. Question 15. Set 15. Which sign indicates a potential complication of a thyroidectomy? Sore throat, laryngeal stridor, fatigue, dry skin. Stridor indicates airway obstruction, possibly from edema or nerve damage post-thyroidectomy. Question 16. Set 16, which is a common side effect of radiation therapy to the head and neck: diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 17. Set 17, a patient with alcohol withdrawal is tremulous and agitated. What medication is usually prescribed? Disulfiram, chlordiazepoxide, methadone, bupropion. Benzodiazepines like chlordiazepoxide, Librium, are used to manage alcohol withdrawal symptoms. Question 18. Set 18, what is the primary purpose of pursed lip breathing? To increase heart rate, to keep airways open longer and promote CO2 excretion, to decrease oxygen consumption, to strengthen the diaphragm. Pursed lip breathing prevents airway collapse during expiration. Question 19. Set 19, a patient on chemotherapy has a platelet count of 20,000. What is the nurse's priority? Infection control, bleeding precautions, managing nausea, increasing protein intake. Thrombocytopenia, low platelets, puts the patient at high risk for bleeding. Question 20. Set 20, what is the priority when a patient falls? Complete an incident report, notify the physician, assess the patient for injury, move the patient back to bed. Assessment of the patient's condition is always the first priority after a fall.